In this portion of administering medications, we'll be talking about nasogastric intubation. The most common time you're going to be tubing a horse is for colic reasons, and you're either going to be passing the tube to reflux the horse if they have too much stomach contents, because horses are not able to vomit, so we need to actually pass the tube in there and relieve that pressure off of the stomach. The other reason you might be doing that is to administer things like oral fluids or mineral oil when they're colicking to try to loosen up their stool. So we have a couple of different types of tubes and types and sizes of tubes. I keep them in my bucket here in the water. When they're just sitting in the water, it just kind of softens them up a little bit, makes it a little easier to pass. Right here I have two different sizes. There's a medium tube here and then a large tube here. You can tell the difference of the size here. I typically, if it's the first time I'm seeing the horse and the horse is colicking, I'll use the large tube because it's easier just to lavage anything out of their stomach. For demonstration purposes today, I'm just going to use the medium tube. So I get the tube here, and what I like to do is just put the tube around my neck like that. Just get the kinks out of it a little bit. Then I'm just going to grab some lube here just to make it pass easier through her nose. Just apply it to the end there. Okay, then we're ready to go. So I have my handler again on the same side. Come up here, just nice and slow. I'll grab her nostril, kind of rub the inside of her nose here, just letting her know I'm here. So then I'm going to start passing the tube, and it's important to keep in mind that you want the tube to be ventral and medial, so down into to the inside here, so you can avoid the ethmoids up here, which if you do hit those, they often will get a nosebleed.
So let me stop there, and I will just give my comments and further insights on this nasogastric intubation. So first off, it would be nice, like if you're going to go in through large animal practice, the typical equine practitioner would have three sizes of the NGT. So meron kang pang small for the foals, then meron kang medium, and then meron kang large, okay? And then for the foal, pwede mo din siya actually magamit sa iba din na, for example, small ruminants pero adult na, no? Kasi syempre magkaiba naman talaga sila ng size, okay? So pay particular attention on how the lady veterinarian is doing the part of the restraint before the nasogastric intubation. Kailangan matindi ang grasp mo dapat sa nostrils ng horse. So, kailangan pag, yung sinabi niya, di ba, na dapat kakamutin mo, no? Para ma-feel ng horse yung presence mo. And then, talaga kailangan, ang pag sinabing grab-grab, okay? So, imaginein mo yan, posibleng kunyari, may sipon pa yan, no? So, walang, keme-keme dapat yan, ano? Tapos, it could also be slimy, yung yung nostrils niya. So kailangan malakas yung grasp mo kasi kahit na slimy siya, hindi dapat bibitaw yung hawak mo because otherwise magkakaproblema ka, no? Pwedeng mag-bulge siya ng kanyang head ganon, tapos pwede na siyang magwala, no? Kasi kinabahan na siya, okay? Tapos, posible na yung attendant natin, yung handler, hindi din siya alert o na-caught off guard din siya, nabitawan din niya yung horse, okay? So, nagkagulo-gulo na inside the stall, okay? So, even as simple as this NGT, kailangan talaga prepared ka, in tune ka with the handler, kasi sinabi niya kanina, diba, you should be at the same side as with the handler. Tapos, yung handler din, dapat yung hawak niya dun sa bridle ng horse pulling down. So, hindi dapat siya magpapadala dun sa jerking ng head ng horse na usually gusto nila pataas kasi they're trying to remove, no? Remove yung kung ano yung foreign material na ipapasok mo dun sa kanilang nose. And it's an uncomfortable feeling kasi syempre foreign material yan. So, gusto mo siyang tanggalin, no? So, ganun yung reaction na gagawin nila. So, dapat prepared ka mentally and physically to do this type of procedure kahit simple as NGT lang ito. Okay, let's proceed.
And when you're passing the tube, you can see that my handler is kind of pulling her nose down here and flexing her head. And that gives you a better shot of going in the esophagus rather than if their neck's extended, you'll go right into their trachea.
Okay, so let me end with that. No, I forgot to note. Be very careful of how you insert the first part or the proximal end of the tube. So, yan kasi yung isa sa mga secret of how you will be successful in doing the insertion. Kasi kung hindi yung end na yan, medyo pa-ventral, and di ba sabi niya, as close to the wall, papunta dito, to the middle side as possible. Kasi kung hindi ka right in that proper direction, you can easily hit the turbinates, okay? And yung turbinates yan, pagka continuously ipupush mo siya, kasi itatry-try mo naman yan medyo trial and error yan sa una Pag ipupush-push mo siya ng ganun, so parang pinupoke mo yung nasal turbinates niya, nagkakaroon ng trauma. So therefore, dudugo siya. So meron siyang hemorrhage, okay? So in my experience, as a novice equine practitioner many years back, 2 beses na ako nakapagpadugo, no? And nakakatakot siya kasi ang daming dugo na lalabas, okay? Pero if in case it happens with you, dapat laging meron lang na nakaantabay na white naman, cold water or ice, okay? So sa mga hindi pa sanay, dapat prepared na agad yung bucket of cold water mo and ice. And of course, ilalather mo yan o kaya ipopour mo doon sa head nung horse para mag-clot yung blood right away. Okay, so yan yung first aid na ginagawa natin. But ideally, of course, over time, as often na nagagawa mo, you develop the skill. Tapos, usually kasi pag nakuha mo naman siya ng isang beses, medyo nakukuha mo na yung technique, no? Basta, always remember, di ba yung sabi ng lady veterinarian, yung direction is very important, ventral, and close to the middle of the nasal septum as possible. Okay?
So here I'm ready. I'm going to slowly start passing the tube. And you can use your right hand here. I'm using my middle finger just to push the tube down. And as you're passing it, just always feel for any resistance. You may need to redirect. So then I'm to her pharynx here.
Okay, let me stop again. Okay, check ko lang ito kung kaya kong mag-annotate, right? So, ito na lang na mouse. Okay. Nakikita nyo yung mouse, right?
Yes po.
Okay. So, yung kamay mo dapat, ganyan talaga, as in ganyan na ganyan. Dapat maganda yung grasp mo. Tapos, itong fingers mo, tip of your fingers mo na to, tumatama siya actually dun sa tube. Kasi it is also your way para hindi siya mag-backtrack. Kasi may accidents na pwedeng mangyari na mag-budge talaga yung head, so matatanggal mo siya. So at least meron ka nitong fingers na nandito nakaantabay na hindi yun mangyari. Okay? Tapos at the same time, yung pinupush mo together with your left hand, okay? Tapos, yan, nakaalala yung right hand mo. Okay? Ito yung common position talaga na ginagawa. Medyo bihira gawin na on the other side siya ginagawa. Okay? Kaya medyo masasanay ka talaga na yung left mo, yung pampasok mo. So, ako naman kasi ay isang kaliwete, so I'm a southpaw. So, medyo sanay ako na active hand ko yung kaliwa ko. So, in this kind of position, gustong-gusto ko to, hiyang to para sa akin kasi hindi ako asiwa o hindi siya awkward position for me.
And you can feel, and you can also watch their throat there and watch for them to swallow. And once you feel the swallow, you pass the tube, and you can see it, often see it going down the esophagus, and it does have a different feel. It's a little bit tighter going down the esophagus, as if you went in the trachea. Often you'll feel it kind of bounce off the rings. And a lot of times if you're in the trachea, they will start to cough.
Okay, let me stop there again. So, isa sa mga signs is usually they would be chewing. No? Isa yan sa behavior ng horse while you're doing the intubation, chewing. At the same time, chewing sila, mag-gulp sila, no? So, and babantayan mo yon. Okay? So, talagang habang ini-insert mo at the middle part ka na noong tube, nakatingin ka na dapat dun sa neck. Kasi babantayan mo na yung flow nung tip of the tube going into the esophagus. And then, sabi niya, di ba, there is resistance. Why? Kasi pagka nakapasok ka na sa esophagus, it's already tight space. So the diameter of the esophagus is taking the diameter of your tube. Okay? Hindi kagaya ng sa trachea, meron na siyang preformed diameter. So pag sa trachea ka nakapasok, mas medyo magiging vigorous yung pag-cough. So isa yan sa sign na titingnan mo. And then, yung sabi niya, dadaan ka dun sa rings ng trachea. So bumpy siya. So mararamdaman mo yon, okay?
Now coughing, they often can cough when you're in the right spot, but that's just one of the signs. So at this point, I'm just going to put the end of the tube in my mouth and just apply a little bit of suction. And I am getting negative pressure, so that's another indication that I'm in the right spot. I'm in the esophagus. If you were in the trachea, you'd just get a constant flow of air. So what I do now is I usually just hold the tube in my mouth, and I'll just blow on the tube as I pass it down, just to kind of help open up the esophagus and then get in. You can tell when you're into the stomach. Now I'm in the stomach, and you can often, in this case, you can hear the gas, and you can smell that definitely smells like stomach contents in your stomach there. So now that you're in the stomach, we have all the signs that we should be in the stomach and not in the trachea. You always first want to put water through the tube, because if you were confused and maybe in the trachea, instead water's the most harmless thing you can put in.
Okay, so let me stop there. I'm actually very amazed with this type of intubation, with the tube that she used. Kasi yung Philippine setting, hindi ganyan. Often you will see the tube, medyo dirty na siya. Kaya natutuwa ko din sa kanya. Kasi talagang hinihingahan pa niya and everything. So, ang ganda kasi malinis na malinis yung kanyang tube. So, dun kasi sa this is a commercial type of tube, something that you can bought online or like in a store na international store abroad. So yung tip niya, meron na siyang funnel. So silicone yan, so hindi siya ganun katigas, 'di ba? Nakita niyo naman sa video na kinakagat-kagat lang niya tapos na-form. Medyo nagiging malleable yung form nung tube. Okay, pero dito kasi sa Pilipinas, ang mga ginagawa na ng mga practitioners, yung typical tubo lang, so mas mura siya, hindi kagaya na PVC type. PVC silicone type yan eh. So yung medyo mumurahin siya, tapos at the end of it, meron na siyang funnel. Tapos tinape na nila, okay? Nakatape na yung funnel. So hindi mo magagawa yung ginawa niya na hinihingahan niya, 'di ba? While inserting, hinihingahan niya. Pero pwede mong magawa na yung first insertion mo na sure ka na nasa esophagus, mag-blow ka ng malakas. Kasi imagine funnel yun, di malaki yun, no? Tapos open na open yun eh. So bubuga ka ng malakas para medyo may makapasok na air going into the esophagus to the stomach, no? Pero hindi mo magagawa yung from time and again na hini-insert mo, hinihingahan niya, okay? But at the end of it, even naka-funnel yung tube mo, pwede mo pa rin naman na ma-feel, maamoy at the end, okay? Yung stomach contents. And then, pwede ka pa rin makapag-buga kahit papano, right? Okay. So, medyo hindi to, di ba? Kung iisipin nyo, masyado pang, hindi siya pang sosyali na trabaho, right? Parang very crude siya, hindi siya pang hindi ka dapat may keme sa ganitong trabaho. Talagang siya, bruskohan. Kasi isipin mo, aamuyin mo talaga yung stomach contents. Paano kung colic yan? Medyo minsan iba yung amoy niya, no? So, it's not for the weak-hearted siguro o kaya yung mga maselan yung tiyan, no? Na nakakaamoy lang ng may iba na yung panlasa, right? So, ayan yung lang natin. Comparison with what's being done commonly abroad and what's being done commonly here.
So we'll just grab the bucket here, and this can just catch the contents of our stomach and the water that we put in just to lavage the stomach out. So then I'll have an assistant come here and hold the bucket, or if you are in a stall like this, you can sometimes just clip it onto the stall door. So this metal pump here, I'll just pump the water in, and it fits snugly onto the end of this tube. So I'll put usually 8 pumps of water in here. And then when you disconnect the tube here, you don't always get a siphon right away like that. Something that you can try to do is just put a little pressure on the tube and try to start to get feed contents from the stomach. And you can see there that there were a little bit of feed particles in there. And if all you were doing is giving a medication, that would probably be enough to confirm that you're in the stomach, and you can go ahead and give a medication. But if you are concerned about colic or reflux and you need to lavage the stomach, you would keep going, and often you'll use 1 to 2 full buckets of water trying to get any of that sour feed or anything out of there.
Okay, so let me stop there again. Like I said, 'di ba, yung local way of doing it is naka-funnel. So siya is medyo social kasi meron gumagamit pa sila ng pump. So the pump is actually expensive din siya. It's like about 5,000 plus to buy it. So ang tube ko actually, the one I actually have is yung kagaya ng kanya. And para sa akin, no, para sa isang babae, ito yung madaling way. Kasi hindi ako mangangalay, no? Pagka yung ano kasi, yung naka-funnel siya, ang ginagawa namin, after mo siyang mahingahan, ganon, iaangat na namin siya. Tapos, lalagyan pala ng, for example, kahit ako, for example, ito, kunyari, ito yung bucket, kunyari, galon ng water o kaya mineral oil, ganyan. So, lalagyan ko siya, tapos iaangat ko yung funnel. So sometimes matagal yung flow of the fluid from the top of the funnel going down, and then you can only transfer so much of the liquid, no? So paulit-ulit siya. And then of course, pagka puno yung funnel, mabigat siya. So pagka iaangat mo siya, mabigat siya. Okay? So medyo nakakangalay siya. Nakaka-build up ng ng mga muscles mo dito. It's a good exercise, pero nakakangalay siya. Okay? And sometimes, no, pag kunyari, medyo chummy mo yung sota o yung handler, siya na yung papaghawakin mo. Sige, ikaw na nga nito, especially pag babae, naaawa sila. Okay? So, yun na yung hawak nila. So, with this kind naman, yung practice abroad, di ba very convenient? Nang nasa video, puro sila babae, carry lang nila, di ba? So, nagpa-pump lang, so hindi kailangan iangat. So, hindi siya nakakangalay. Tapos, yung pump, mabilis. Okay? Pero, pwede mo siyang bilisan. Pero, kita nyo naman sa video, hindi naman niya binibilisan talaga. So, konti lang. And as like she said, pag colic, as much as possible kasi, ilalabas mo yung contents sa loob ng colic. Tapos, medyo papalitan mo siya ng laman. So, kaya makakaipon ka talaga ng 1 to 3 buckets of the gastric contents. Okay? Papalitan mo siya ng electrolytes, ganun. So, yun na yung mga ilalagay mo dyan. Okay? So, yung ginagawa niya, di ba, nag-siphon siya. Okay? So, either with the pump, magsa-siphon ka, o kaya siya, hinigop niya ng hinigop hanggat sa bumalik yung mga gastric contents. So, naiilabas niya ngayon doon sa bucket. Okay?
So, in this case, I'm just going to give her a little bit more water just to simulate that I was giving her medication. So I'm going to do a few pumps here. And then when I'm done, I'll just disconnect here. And then I'll just blow the medication through the end of the syringe. Kink it off so nothing comes back. And then you can go ahead and pull the tube. And you want to make sure their heads, keep them nice and quiet when you're doing this, because you can, when you get through their nose, it can flick up and give them a bloody nose at that time too. So you just pull it out nice and slowly. And that concludes how to give a medication by a nasogastric tube.
Okay, so that's it for nasogastric intubation. So kung ano yung restraint na ginawa niya in inserting the tube, it should also be the same when you are already retracting the tube. So you do the process as quiet as possible, as calm as possible, okay? And then hindi basta-basta mo siyang hihilahin yung tube, okay? Kasi medyo masakit din yon, and still, it's uncomfortable for the horse. Yung friction na dumadaan, and kung mabilis mo siyang huhugutin, mainit siya sa loob. So it can also give, abrasion and then unnecessary trauma doon sa lahat ng dadaanan noong tube. Okay? And at the last part, dapat hawak na hawak pa rin niya yung distal end of the tube, proximal end of the tube, para hindi na siya tumama pa yung parang ganun. So kung ano man yung content pa na fluid, hindi pa siya tumama sa'yo o kaya di ba makalat lang siya. Okay? So ganun lang din yung ginawa. The handler should always be alert at the same time. Pwede naman kayo magkwentuhan while you're doing the actual yung parang pagpasok ng fluid, and then kunyari paglabas ng fluid pwede naman, but still yung guard should always be there, hindi dapat makampante kasi at any time pwedeng mag-berserk yung patient, especially if it is a colic patient, masakit yung kanyang tiyan, so in pain siya, so syempre irritable siya, ganun. So we should always be particular with that. Okay? So the next video I'm going to show you is the second video in the study guide, which is an animated picture of how the tube is inside the horse. Okay, the horse's head. Hindi yan. Teka ha, hanapin ko lang. Nasaan na ba yun? Okay. So, while I am preparing that, ito na lang muna yung tingnan natin.
Usually when we're administering a large quantity. So I want to start by introducing you to the nasogastric tubes and talking a little bit about the care and nurturing of them. So we have, it's a long tube because it is going from the nasal passage, nasal orifice down to the stomach. A lot of us have our tubes marked certain places. It gives us an idea of how much tube we actually have introduced in the horse. Tubes come in a variety of sizes and diameters. There's about 5 or 6 altogether, probably, but these are showing you a variety of the smaller types of tubes. This would be a type of tube that you would be using with a newborn foal, for instance, and it would go on up to sizes that would be about twice the diameter of this tube we have here. We get very possessive of our tubes. We like them for a certain type of consistency that they have. We like the tubes to be kept very clean.
Yes, very
we don't
clean.
want them to be damaged. We don't want them to be dropped on the ground, have grit rubbed into them. We don't want this to be rough because this is going to cause irritation to the nasal mucosa. So we like them to be nice and smooth. That means that they have to be taken care of when they're out of the horse. When we are finished with them, they get cleaned. We use a soapy solution. We'll use something like this syringe so that we would flush a soapy solution through them, rinse them well. We like to then hang our tube up somewhere so that it can dry. And then when we store it in our car in the hospital or something, we like to keep it in this position so that we have this coil to it. This coil helps us a lot when we pass the tube, because when we're passing it down, we want to be able to pass it in this way and knowing that it's going in the ventral meatus and staying down there. So we just use this type of a case that we keep in our tubes in the car so they keep protected. And they sort of keep in that coil. So that works out nicely. So let's get on to Leroy.
Okay, so let me stop there first. So what I like about this video is it has shown us how to take care of the tubes. So I've seen several tubes here when we do our rounds. talagang my gosh, may mga fungal infection na siya may fungal growth na siya sa loob. So medyo nakakatakot siya. So talagang naa-amaze ako kasi yung video na nakita natin kanina, binubugahan pa nila, tapos talagang kinakagat nila, no? So medyo hindi kasi siya common na procedure or common na ginagawa dito kasi nga madami talaga akong nakita, may fungal growth talaga sa loob. So, hindi siya masyadong nalilinisan. And then, maganda yun no, na talagang meron silang pouch for it. Kasi dito sa mga ibang ano dito, kadra, nakasabit lang siya dyan, ganun. So, talagang kakapitan siya ng mga mikrobyo. Hindi siya masyadong nalilinisan. Tapos, di ba, mahirap siyang sa haba ng kanyang tube, mahirap naman talaga siyang i-brush kasi mahirap naman makahanap ng brush na ganun kahaba. So, yung pinakita niya, medyo possible kasi yon liit lang yung diameter ng mga pinakita niyang tubes. Commonly, yung tatlo na yun na pinakita niya, small yun lahat, no? So, yung sabi niya sa foals, 'di ba? Newly born foal, tapos yung iba, grower foal, ganyan-ganyan. Pero yung tatlong lahat na yon, small yon compared dun sa medium na pinakita dun sa unang video kanina. Okay? So, in-emphasize niya yung aftercare and proper care nung tubes. Ganun siya ka-important na dapat very clean siya all the time. And dapat hindi nga siya magda-dry kasi pag nagka-crack siya. So, it's time na napalitan mo. So, maganda din na linulubricate mo siya at hindi siya dun sa exposed area sa sunlight para mas tumagal yung tube mo.
Final means of administering medication that we're going to demonstrate is passing a nasogastric tube on a horse. So there are a couple different reasons why you might do it. One of the reasons might be to both diagnose and correct a choke, which is a blockage of the esophagus.
Another thing would be when we dealing with colic cases, we like to pass the stomach tube, see if we have reflux. In other words, an increase in fluid in the stomach that we'd like to get out through the tube, or to administer large amounts of medication like mineral oil in the case of a colic, and we'd be giving a gallon, half gallon of medicine.
Sure, you can't ask them to just swallow a half gallon of medication. And certainly from the tech's point of view, the vast majority of the time you're going to be in charge of restraint, or possibly you're going to be in charge of drawing up medication, that sort of thing. But we're going to demonstrate it as if I'm the tech and I'm in charge of restraint.
Mm-hmm. And it's just so important. Different ways that we do this, and some veterinarians like to pass on the left-hand side here, and this is the way Dr. Forney and I both like to do it. We like to have the tech on our left side, on the horse's left side, and we like to be on the left side. So we're both working here together. We know where each other are. We can stay relatively out of danger back by the horse's shoulder. But there isn't somebody on the far side of the circle if the horse is circling around us.
Yeah.
Sure. Now, the kinds of things that a horse is going to do to evade being tubed, frequently they'll back up. And so the fact that Leroy's got his rear end towards the corner is not an accident. We put him this way on purpose. And then, of course, they can strike. So you want to position yourself so that you're, beside them, not in front of them. And as the tech, you want to position yourself so that you're beside them and you're not pushing the veterinarian directly in front of them. You got to give them space to work. And of course, they can rear up. And, again, that's being on the side is the best place to be. And then a certain amount of head flinging goes along.
Yeah. So yun yung sinabi ko kanina, yung head flinging, right? So be prepared with that. So what I like about this video is it gives you the nitty-gritty details na kailangan alam mo, especially if you're a novice veterinarian going to handle horses. And if this will not be taught to you, you will learn this over time. Pero baka masaktan ka, may ibang masaktan na, may maging aksidente, bago mo pa siya matutunan. So, it's good na sinasabi nila lahat nitong mga ganitong detalye. So, very important, if you're going to do anything sa horses, kailangan well-planned yung area kung saan mo siya gagawin. So, maganda to na in-emphasize nila na commonly kasi talaga i-evade niya yung foreign object. So, mag-headbutt nga siya and then pwede siyang kakamot siya, yung ganun. Gaganon nga siya. Kaya sabi, you should not be in front of the horse, at least the handler. And back up din siya kasi it's a flight horse, flight animal, di ba? So, kaya kinorner nila para hindi na sila mahirapan. So, it's actually more challenging for lady veterinarians like me kasi, syempre physically, mas challenging for us as compared to male veterinarian. So, kaya kailangan mas ginagawa na lang namin ng strategy na yung mga ganyang details para hindi kami mahirapan. No? So, we're using tools, we're using the strategies para ma-compensate kung whatever lack in physical power as compared to the male veterinarians.
So you always have to be sure that you're not getting so intent on your work, me passing the tube or the tech somehow that, you start to get your head up close because they are so fast and the head is so hard.
Yeah.
So I think that kind of covers. So let me get ready to actually pass the tube.
Sure.
All right, now we're ready to pass the nasogastric tube in Leroy. As we said, we're positioning on the left-hand side because it gives us a better view of everything. We've decided what size tube we're going to use, as we discussed earlier. Your size of your tube needs to be related to the size of the horse and what type of medication you're going to be giving to that horse. This is a Jupiter tube, which has a nice consistency to it, and in spite of it being a little chilly today, it stays nice and pliable. Sometimes you may want to put your tube into some hot water to get it to a nicer consistency. We like the tubes to have the coil to them, and you'll notice how I'll be passing this as I pass it into his nasal passage.
Okay, so let me just emphasize yung sinabi on both videos. Kailangan medyo ibabad mo muna sa bucket of water, preferably lukewarm, before using it. Okay? So, hindi pwede na, hindi naman yung overnight yung nakababad. Pero like, alam naman yan pagka may schedule na tutubuhin yung isang kabayo. So, isa na yan sa prep mo is, ilublub mo muna siya sa tubig, preferably lukewarm, before mo siya gagamitin. But still, aside from na nakababad siya sa tubig, kailangan mo pa rin maglagay ng lube. Okay? Ideally yon. Pero commonly dito sa karera, hindi na naglulube o kaya hindi na naglalagay ng oil. Tubig na lang talaga. Pero kung ako lang naman, kasi imaginein mo, 'di ba, ang tubig hindi siya naman talaga magandang lubrication kasi natutuyo lang din siya agad. So, mas maganda pa rin talaga na gamitan mo siya ng lube or mineral oil when you are going to pass it dun sa kanyang nares.
We usually put it around our neck just to keep it more tidy. And I like to use some lubricant. So some people don't feel it's necessary, particularly with these very smooth tubes. And this is one reason you want to take care of your tube, is to keep it nice and smooth. And I'm going to also be putting this tube into my mouth because that gives me a third hand. So it'll be a little bit difficult for me to talk. So maybe Dr. Forney will help to talk on some of this too. But because I'm on the left side, I don't have to pass the tube only in the left nostril. I can reach over and pass it in the right nostril also. So we'll see which way he accepts the best. But so just by us being here on the left doesn't limit me too much. See what he does.
Little big guy. Now, of course, again, Leroy was chosen for this not by accident, because we think he's probably a pretty nice guy to pass a nasogastric tube on. Dr. Hamill's all the way back into the pharynx, and she's prompting him to swallow a little bit by manipulating that tube a little bit and bumping up against his pharynx. And there, I think we got a swallow just then.
Okay, let me stop there. So see, as in contrast with the previous video, they inserted the tube this time on the left, right? No, on the left. Yung first video, it was on the right. Okay? So, pwede naman siya either left or right. So, sabi nga nila, depende sa temperament ng horse, depende kung saan siya sanay. So, before you do it, it would be nice to ask the handler, lalo na kung hindi mo nga kilala, di ba? First time mo siyang ma-encounter, you ask the handler, o saan ba to tinutubuhan, no? So, but commonly, pag nasa left side ka, commonly sa right talaga na nares ang insertion ng nasogastric tube, okay? Kagaya nung nasa first video. Pero 'di ba, sabi natin natutunan sa Zootechnics 115, ang position mo should be on the left side, no? Very common sa left side ka naka-position, left side of the horse, okay? So pag mag-ride ka ng horse sa left side ka, ganun. So dun sila sanay, okay? So rarely na nandun ka sa kabilang side doing the intubation, okay? But it's possible, no? Again, you have to work with the handler, and kung minsan kasi no may mga ibang cases na it was not successful na in-insert mo dun sa kabila, so lilipat ka dun sa kabila, okay? So nangyayari din talaga yan.
Veterinarians have a variety of different ways that they use to tell where they are. It's partly by feel, because the esophagus is a potential space. See, we're still trying to persuade him to swallow with this tube. This is normal, and this we expect as a part of tubing a horse. He's being a really good guy about this. He's standing here. He's not swallowing all that well. One of the things I can do to help Dr. Hamill is by pulling his pole in a little bit and causing him to flex a little bit at the neck.
Yeah.
And sometimes, yep, there you
We're
go.
in now.
Now we're in the esophagus. Sometimes on the left-hand side, you can see the tube passing on the esophagus, and she's watching for that. I just saw it go by.
Yeah, me too.
And sometimes we joke around about how you could see it, you can hear it, and you can smell it, because when you get down to the stomach, you can get the gas coming back from their stomach.
Yeah.
We're going to pass on to the stomach now.
Now,
Okay, so let me stop there. Diba, sabi nila, there are 3 senses, no? You can hear it, you can see it, you can smell it. Okay? Dun sa pag-hearing, of course, hindi mo siya masyadong maririnig kung maingay yung lugar. Kunyari, madaldal yung sota. Kasi maraming madaldal na sota. Okay? So, quietly ask or respectfully ask na, sige, ano muna, tahimik muna tayo. No? Especially kung baguhan ka pa lang, no? Hindi ka pa sanay, na nakikita mo siya, na pumasok, na lumunok siya, right? Kaya okay lang naman na tahimik muna. Pero 'di ba sabi nga, ideally tahimik naman din talaga dapat yung area, kasi nga magugulitin yung mga horses.
a little handhold on his neck, and you can see I'm staying in nice and close, and Dr. Hamill is off center on the front end. Again, that's normal, and you can expect the horses to be a little ticklish in the back of their throat as you're passing that tube on down.
Now I've just popped into the stomach now. I could actually feel the gas come into my mouth, and I can blow on the tube, I can suck on the tube, but these are all aids that I use to be able to tell me where I am. So usually once we get back past the pharynx area here, they become more comfortable. You can see that Leroy now is quite comfortable. He'll hopefully, stand here comfortably while we give him medication and so on. I'm going to pass this on to the tech, Dr. Forney, here, and she can stabilize the horse and stabilize the tube also once we know that the horse is going to accept this all right. All right, so we have Leroy here, and you can see he's relatively comfortable with the tube in his nose. Talking about some of the medications that we might be giving here. If I was giving a relatively small amount of medication, like for instance, like our old-fashioned worm medicines and so on, a lot of times we would give this by gravity flow, just be able to pour in here and let it run down your tube by gravity. Not much, I don't do that much anymore. Do you?
No, the exception would be when I'm giving colostrum to a newborn foal.
There you go.
I do that with gravity flow.
Good point. Yep, and that's if you really want to fine tune how that's running in and so on, you would use the gravity flow. It's a good point. If I was going to be doing a large amount, like I wanted to give some fluid therapy and I wanted to give 2 gallons of fluid into his stomach, I perhaps would be using something like this stomach pump that will really pour out I can get quite a flow going there. Again, that would only be used in special circumstances when you'd want to use at high volume.
Sure, but like when I used to oil a lot of horses that were shipping, giving them a half gallon of mineral oil, I commonly use the stainless steel pump. I mean, that's
Right,
what I
so
use.
that you can get it in a hurry. Probably one of the things that we use the most when we're dealing with colic cases, and in which case we're kind of using medium amount of fluid that we're putting in or oil that we're putting in. But a lot of the time we're trying to see whether or not we get a reflux from the stomach. So this is kind of a little special technique that we'd be doing. So you'd have the tech holding the tube here. Oh, slid it out a little bit. Okay. And I would be filling that tube up with some fluid. Right, so I'm actually going to press this down into the stomach.
And what you're basically going to do is you're establishing a siphon. You're filling your tube up with water, and then you're putting it down below the level of the horse's stomach to see if you have an overfull stomach. And then you would siphon out gastric contents, which, and as you can see, coming out of our tube, and this is an absolutely normal horse, but we're actually siphoning out a little bit of gastric contents on him. Out she comes.
Oh, there we go.
There you go, just like that. Now, it can be impressive in a colic that's really sort of at the front end of the GI tract, how much gastric contents you can get out. You know, they can have a buildup of a couple of gallons.
That's right. They'd fill that bucket.
Right up. And so, but really, technically, all you're doing is establishing a siphon here.
And we sometimes will play a little bit with that tube, pull it out a little bit, push it in a little bit to try to get that siphon going.
There you go. Now, Leroy's
Good demo.
very normal.
Right. Okay, then, for instance, if we were dealing with a colic case, you might then be asked to put some mineral oil, put some water down in the stomach, which case, again, we would just be using, say, filling this with water, putting the water down into the stomach through this. This is our mineral oil, and comes in a container such as this. It's messy stuff to deal with, but we often will give the colic cases a half gallon of mineral oil. So there's lots of things that we'd be giving, and rather, sizable types of volumes that we'd be giving. You notice that with this equipment, one of our safety features that we like to think about is that we want to have the horse and the people be positioned such that if we have to exit in a hurry, we can be out the door. You don't want to get yourself in a position where the horse is between you and the door.
Sure, absolutely. I think we're just about ready to take this tube out of.
If I can get some of the things out of the way. Leroy thinks it ought to come out.
Yeah.
Okay, when we do this, usually I'll put a little bit of air down the tube to clear the tube. I may blow on it like this to clear the tube. Again, I want to have good restraint on the head. I'm going to pull the tube out in a smooth type of an action. It's very important to keep the horse restrained at this time so he doesn't fling his head about any more than absolutely necessary, so that we get the tube out in a smooth action. One of our problems with tubing horses is that we have a very fragile nasal mucosa here, and we can, no matter how hard we try to keep our tubes nice and smooth, as gentle as we like to be, we can get some trauma there and get some nosebleeds. And this is undesirable, but again, it does happen.
Well, no.
Yeah, let me stop there, no? Sabi nga niya, undesirable. And as much as possible, you do ways para hindi mo mapadugo yung nasal turbinates. But yes, it does happen. So even with already expert veterinarians, nangyayari pa rin sa kanila. So always, dapat your guard is always up for any accidents that may happen. So maganda yun na meron ka dapat lagi nakaantabay nga na cold water or ice pack para you can provide the first aid as soon as possible. And what I also like about this video, sinabi nila, di ba, na yung area, no, there should be like an open gate. So anytime there is a problem, they're inside the stall kasi, so they can easily exit, no, to protect the handler, the SOTA, and then the veterinarian.
These are a recognized complication of tubing horses, and if you tube any number of horses, you're going to have the occasional nosebleed, and it's not serious. It looks serious. There's blood everywhere. And it's very annoying to the horse to feel that blood trickling down his nose, and so he starts blowing it on you, blowing it on the client, blowing it on the walls. But nobody ever died from a nosebleed.
Yeah. So it's people have a tendency to panic, but they really don't have to panic. And the good thing is if you stay unpanicked, it helps the client stay unpanicked.
That's true.
Leroy was such a good patient, and he didn't really need very much restraint, but I think we need to talk just a little bit more about restraint when you're tubing a horse. Lots of practitioners will routinely twitch every horse that they tube. And so one of the things that you can do as a tech that'll make everybody look better, make it go better, is to be aware of the direction in which you twist the twitch, because the direction in which you actually take the loop is going to dictate which side of the nose is more open. So let's go ahead and put a twitch on Leroy, and we can show this. Or I hope we can show this. So if I twist it this way, which in this case would be clockwise, I am twisting it away from that left nostril, and I'm making his left nostril larger than his right. So I'm giving Dr. Hamill a better target. So that's certainly one of the things you can do with the twitch when you're restraining. If you have a really fractious horse, lots of practitioners will routinely sedate them.
It'd be a lot safer for both the handlers, the practitioner, and the horse itself. And you know, as we've said before, our sedations are so good nowadays that a lot of people, actually clients, you know, prefer that.
Sure, and there's no sin in sedating them. You know, there's no point in anybody getting hurt.
That's right.
And then, of course, last, we have to sort of think about what you're going to do with the client while this is going on, because as always, you know, we want the horse to be safe, we'd like to be safe, and we very much would like for the client to be safe too.
Right, and you saw with the technique we used, there were two of us. Sometimes it'd be handy to have three people, and so the client wants very much to get involved sometimes. And there can be times when we may have the client administer some of the medication because we have to be tied up when actually controlling the horse. But we try not to do that. We try to have them standing out of the stall so that we know where everybody is in the stall, we're working as a team, and nobody gets hurt.
Yeah, just in case the patient starts to explode.
Okay, so let me stop there. That's the end of the video. Again, no, ang ganda ng video kasi pinakita pa rin niya na if in case the patient is not too cooperative, na kailangan mong magbigay ng additional restraint, the common one is the lip twitch. And it was demonstrated properly. Lip twitch is being held by the handler or the SOTA. So together, yung isang kamay niya nandun sa twitch, yung isang kamay niya nandun sa bridle. So pwede naman yun, okay? And then again, yun yung isa sa itatanong mo dun sa SOTA eh. Mabait ba to? Sanay ba siya na tinutubuhan siya? And then right away, sasabihin naman sa'yo ng handler, kasi commonly naman, wala naman lokolokong handler na magsisinungaling sa'yo. Kasi kung magsinungaling siya, magkaroon ng aksidente, malamang isa siya sa casualty kasi siya yung nasa loob ng kwadra. Okay? So, nasabi din kanina, there are some clients na gusto nila involved sila. So, you have to establish na less people should be inside the stall while you're doing the intubation. So, it's usually just 2. Mas maganda 2 lang, ikaw, tsaka yung handler. Okay? Tapos, doon na lang siya sa may medyo labas, okay? Para naman hindi na tayo madadagdagan pa ng iisipin na kailangang umexit agad if in case there's a problem, okay? So that's our second video. Let me try to show you the third video. Ito yan, ito yung nasa guide natin. So, yung video na to, mabilis lang siya. So, uulitin ko na lang siya. Okay? So, you have to read itong part na to. So, yan, dadagdagan yan. Tapos, you also have to check yung progress ng insertion ng tube dito. Okay, ulitin ko. Ulitin ko ulit. So this will be the last repeat. Okay, so na-end ko siya bago siya mag-replay. It's important, no, you allow the horse to swallow the tube first. That's an important reference or landmark before you proceed inserting the rest of the tube inside the body of the animal. Okay? Para kampante ka, confident ka that you are in the esophagus and you feel the resistance. Okay? Yung common na nangyari dun sa dalawang videos is pareho yung end ng isang end ng tube nasa bibig nila. So easily they can already feel na may bumubuga na abdominal air papunta sa kanila, no. So imagine, no, kung kunyari medyo hindi ka sanay sa mga ganito, mandidiri ka siguro kasi you're already one with the horse. Yung niya, abdominal air niya, nararamdaman mo na, okay? So, doon sa gravity flow na pinakita on the second video, hindi mo yan mai-experience yung sudden buga ng abdominal air kasi naka-funnel siya. Okay. Okay lang naman na kunyari, kagaya nung sa second video, nakahiwala yung funnel doon sa end nung tube. Kaya lang, kung ganun ang ginawa mo, meron accident na malalaglag yung funnel, ganun. Tapos, may spillage ng kaunti, yung ganun. So, may mga pros and cons din. So, depende kung masanay ka. Kung ako naman, di ba, parang sila sa abroad, hindi na sila fan of doing the gravity flow. Parang old way na yun para sa kanila. Although dito, yun ang kadalasan na ginagawa. Kung ako naman, mas gugustuhin ko na meron akong option. Kasi madali lang naman bilhin. Kumbaga, yung funnel, madali lang naman bilhin. So, have that option na pwede kang magtrabaho na may funnel. Tapos, kung kaya mong bumili ng pump, pwede din naman. So, para kasi sa akin, madali yung pump. Hindi ako mangangalay na kakahawak ng funnel pataas. Okay? But then again, pwede mo din naman siyang i-assign or i-designate sa iba pang SOTA kung friend mo sila. Okay? So, that's it for the nasogastric intubation. Do you have any questions?
One question lang po. What do you mean, Doc, by letting the horse swallow the tube, Doc? Kasi parang dire-diretso naman po yun. Or something.
Oo, yes. Actually, makikita mo kasi yung flow, 'di ba, nung nung anatomy niya. So parang pag ganun siya, right? Ganun. So pagdating dito sa bandang ditong part, so medyo magkakaroon ka ng konting resistance niyan, right? Okay. So medyo konting abante ka. Ang pag-abante mo dyan, konti-konti lang kasi parang tinatansya mo kung nasaang part ka na. Tapos, dito, by the time na nasa pharynx ka, okay, yung pass through ng tube mo or yung konting pagsusundot-sundot mo, it will induce swallowing of the horse. Kasi yan yung epiglottis, di ba? Yan yung epiglottis part. Actually, ito yung epiglottis, yung arytenoid, ganyan. So, pag dumaan ka dun sa part na yon, it will induce swallowing. So, yun yung abangan mo. If you can remember, dun sa second video, mas evident na nagka-cough, nag-chew. So, yun yung mga early signs na pumapasok ka doon sa tamang part, going to the esophagus, pero nandito ka pa lang sa may area na yan. Okay? Tapos, pag medyo nandito ka na sa may banda, pagka medyo sinundot mo kasi to, mag-i-induce siya ng swallowing. Okay? Tapos, pagka idire-diretso mo lang, from then on, you will feel the resistance. So, sa area pa lang na yan, mararamdaman mo na kung meron resistance, that's a good sign that you're in the esophagus. If not, kung pag-swallow pala niya, dito ka dumiretso, mararamdaman mo, walang resistance. Meaning ng resistance, kunyari, ganun-ganunin mo yung tube, ikut-ikutin mo yung tube, pwede. Kasi walang nagre-restrict na maliit na diameter, no? Pag esophagus, marirestrict niya yung movement. So, hindi mo magagalaw-galaw yung tube, okay? And yung isang feeling is, tatama ka sa mga tracheal rings. So, corrugated yung pakiramdam. Para kung nagda-drive ka, dadaan ka sa rough road. So, parang ganun, no? Ganun yung feeling nung tube. Mararamdaman mo yung rings. I promise you, mararamdaman mo yung rings kung nandun ka. Pero mas mararamdaman mo na walang resistance. So, yun ang mas una mong mararamdaman. Kasi what if, nasa middle ka ng trachea, so hindi ka tumatama sa wall, sa floor ng trachea, no? So, hindi mo mararamdaman yung tracheal rings, okay? So, yun yung, medyo tatandaan mo. Honestly, so yun ang two areas na medyo dapat pag-ingatan dito sa area na sa turbinates, no? Para hindi siya dumugo. And then dito sa area sa may pharynx. And ito kasi, kung mapapansin mo, itong type of tube na to, meron siyang mark, no? So may sinabi siya na at the level of the mark, sukat mo yan eh. Dapat, you are one with your tube. Kaya medyo mahirap na pag humihiram ka ng tube, hindi ka sanay, hindi mo basta yung hawak mo sa tube, hindi ka sanay, you are not one with the tube, hindi mo sa ulo yung sukat, yung haba ng tube. Na pag pinasok mo kasi yon, medyo may tansyado mo, okay, nai-imagine mo yon na itong ganitong length ng tube, dapat nandito ka na sa may larynx ng kabayo, parang ganon. So yun, and it helps you kung na ang tube mo wala nung mga markings na ganito, markahan mo, maganda yon para isa na yun sa palatandaan mo na kung nandito ka na part, nandito ka na part. Para pag alam mo na lumampas ka na dun sa mark, dapat nakikita mo na nagsaswallow na siya. Okay, ang haba ng explanation ko. Sana naintindihan mo. Okay. Any questions? May questions pa po? Okay. Yes. Thank you for your question ha. It's very important, no? Kaya maganda na nagpa-clarify ka. Elisha, do you have any question? Okay, wala naman siyang chinat. So, I would suppose wala siyang question. So, balikan natin yung pre-operative procedure. So, tapos na tayo dito ha sa